Welcome to HealthPod, your self-development hub
on mental health, psychology, and spirituality.
Cancer patients don't always have to die from cancer. Stress is a killer. And I got cancer, why did I get cancer? And I asked them, do you have stress in your life? 9 out of 10 tell me yes. If you control your brain and your attitude towards things, you can control the outcome.
I think that a lot of people might understand that there might be something wrong, but they're hesitant in facing reality.
Panic doesn't serve anybody.
Today, we have with us Professor George Astras. He is a medical oncologist and he's one of the pioneers of oncology and cancer treatment in Cyprus. He's also a professor of oncology and medicine at the European University of Cyprus. He specializes on the diagnosis and treatment of rare tumors. And we're here to discuss about the ways that we can avoid cancer in our life and how our mental health contributes in the variety of physical issues that we might face in our life later on. So stay tuned and enjoy the following episode. So is the mic close to you? Close to you enough?
Dangerously close.
Dangerously close, okay. Dr. George Astras, such a beautiful surname.
Thank you.
I was extremely fascinated by you when we first met at a kids' party. When I've asked you, what do you do for a living? You told me I'm possibly the last person that you would like to see in your life.
True.
And you told me that you were a medic, and I had to guess. And immediately it came to my mind that you are possibly an oncologist. So there is this fear potentially around oncologists because most people know that when they're diagnosed with cancer, potentially this could mean the end of their life. Is that absolutely true, or can we recover?
Okay, well, it's a nice statistic people don't know.
Uh-huh.
We actually do cure 80% of our patients.
Wow.
Okay? The problem is that you always hear about the 20% that gets the cancer back or has stage 4 cancer, that we have to keep them alive for as long as possible with treatments such as chemotherapy, immunotherapy, targeted therapy, etc., etc. When I first came to Cyprus, there was a taboo about cancer and cancer care. And I remember, this was like 12, 13 years ago. I went to a party and, I was meeting people and say, hi, my name is George. And when I said to somebody, I'm an oncologist, they refused to shake my hand, as if they would get cancer from shaking my hand.
Did they put their cross as well? Like
It's very strange, the general attitude and the general response you get from people. There are some people that hug you and say, oh my God, God bless you, you have a lot of people. And there's others that, keep a distance from you. Thinking they don't want to be associated with the disease or somebody that is close to the disease. Okay, and over the years, we managed to break the taboo, especially, I don't know if you know this, I was involved in the Movember Foundation, and I'm one of the, 4 or 5 people who initiated Movember in Cyprus, and now I think has become a phenomenon in Cyprus every November. And it was very nice to see the stigma, break over the years. And now I think we're in a good place and people are starting to realize that cancer patients don't always have to die from cancer. They can live a nice life, even with stage 4 cancer. A lot of them do keep going and has become a chronic disease for them. But we cannot save everybody.
Hi guys, Thank you for watching. I'm Dr. Stefano Sianu and I'm a psychophysiologist. I specialize on stress and anxiety and also on communication issues between couples. So for those of you that might be facing this type of problems, I provide the link for you below to book your one-to-one session with me. See you there.
And we cannot help everybody. Obviously, we will have people that we cannot do anything about.
Okay, I understand, but let's focus on the positives because, as you said before, 80% of patients that come to you, they can actually revive and they can actually get over cancer.
Yes.
And which is an exceptional statistic that I was not aware about.
It is a global statistic. It's not just us, but we as a country, we're doing great in the fight against cancer. What we always need to remember is that we should give people the chance and give them options. Mm-hmm. Okay. And, as I always say to patients, you have nothing to lose. Okay. Trying to help yourself. Okay. Provided your quality of life is good. Obviously, we're not going to give treatment to somebody, and affect his quality of life. So it's essential to have this in mind. We want people to live longer, but with a good quality of life.
Absolutely. And you've mentioned something about Movember. Mm-hmm. For those that might not know what Movember stands for, we're talking about prostate cancer.
Yes. Prostate cancer, testicular cancer, and men's health. Okay, and these are the three issues that affect men. And what I'm going to say is that depression affects men more than women. I had a friend that used to, and I think he did a very nice post, and he started like, I have a black dog. And he was describing the dog, but it wasn't the dog, it was a depression. I have a black dog means I have depression.
And this black dog, we used to follow him everywhere.
Exactly. So you have to understand that men will not talk about their depression, and they will not talk about men issues, whether it's prostate cancer or testicular cancer. So we cure a lot of people, and they never talk about it, or they have depression, they don't talk about it. And this is where the Movember Foundation started, to try and help and break the taboo against cancer. So and it all started with one lecture we did at the American Medical Center, 14 years ago.
Wow. It's amazing the things that I hear, because many people have this perception about what goes on in the island and they're losing hope. But it seems like they're individuals such as you that looks for a brighter future and tries to cater for people's needs, expressing, admitting certain flaws, whether that's depression. And do you see that depression or any form of mental health issue could lead to cancer?
Stress is a killer.
Okay.
We know very, very well that stress is a killer. There's been trials and there's evidence and medical evidence that stress causes cancer. It's one of the primary, causes of cancer. Always I ask the patients that I see, they come, they see me, and I got cancer. Why did I get cancer? And I ask them, do you have stress in your life? Or was there an event that caused a massive amount of stress? And they tell me yes. 9 out of 10 tell me yes.
9 out of 10.
And it's the same statistic as smoking. 9 out of 10, 9 out of 10 are smokers. So if, and this is the debate, if smoking wasn't a cause of cancer, the statistics would be 50-50. Well, it's not 50-50, it's more. So smoking is a cause of cancer, and not only lung cancer. It causes other types of cancer.
I see. So which are those environmental factors, including, we've just mentioned stress and smoking, that will predispose an individual to developing cancer?
Okay, apart from those two that you mentioned, alcohol, okay, obesity, bad eating habits, lack of exercise, having too much sugar contributes. If you live in a polluted environment, lots of environmental pollution, carcinogens. I have lots of patients who are involved around chemicals. Either they have fields and they spray their fields and they don't wear masks, or I have a few pool cleaners, who don't wear masks because you put all these chemicals in the pools. There's fumes that they inhale. So all these contribute, and also viruses cause cancer. Hepatitis B, hepatitis C viruses, they cause hepatocellular cancer. Epstein-Barr virus, can cause lymphoma. There is other infectious agents, H. pylori, Helicobacter pylori, which is a bacterium of the stomach, can cause gastric cancer, and a type of lymphoma called mold lymphoma of the stomach. So it's not one thing; it's many things that can contribute and lead to cancer.
Multiple factors.
What I frequently see is stress, obesity, alcohol, and smoking. These 4 are the main.
Four factors. I have a couple of questions for you, hearing you speak, because we've mentioned stress, and many people are trying to find substitutes to alleviate their stressful state. It could be smoking, it could be alcohol, it could be drugs, it could be a variety of things. So
that's the wrong decision.
That's the wrong decision, right? Because it's like you're combining a negative, not triad, like...
Two negatives don't make it positive.
Two negatives don't make it positive, exactly. So people are slowly being led because of their mental state to making wrong decisions in regards to food, comfort eating, not exercise.
That's the basis of addiction. If I feel sad, I find something that makes me happy. If I overeat, it makes me happy. Food makes me happy. So you become obese. Obesity leads to cancer. It's linked, Or smoking makes me feel better, or it makes me look cool. But it's not so, It'll make you cool and you think you're invulnerable while you're young. And, when you reach the age of 60, you get unfortunately lung cancer. And then you start going to the oncologist and asking him, why did I develop lung cancer? And I, without telling me, ask them, when did you start smoking? And they are shocked why I realized they used to be or are smokers. You can tell, but you shouldn't follow the addiction. Everything starts from up here, and you have to think that if you control your brain and your attitude towards things, you can control the outcome.
That's beautiful what you said, and I want to pick your brain on something a little bit deeper, from the medical side. How does stress give rise to cancer? Is there any chemical process that goes on in the body?
Lots of chemical processes. I'll explain the simplest one. When you get stress, there's increased acid in your stomach. Acid goes up into the esophagus and burns the entry point into the stomach. And it creates a thing called Barrett's esophagus. And Barrett's esophagus is the initial metaplasia from a normal cell to cancerous cell. And over time, and you hear people that they get like a burning sensation in the stomach and
acid reflux.
On this. Well, this is signs that you have stress, and this is signs that there's something wrong with your stomach.
Amazing.
And you should look into it, not ignore it, because over time it will cause inflammation and cell changes to the esophagus. So acid slowly burns the cells of the esophagus, okay? And they will change into cancer over time. And hence you will get cancer of the esophagus. So this is only a simple example that how stress can create cancer.
Very important information for people to know.
See, this is the thing, your body always tells you what's wrong, or if there's something wrong. It's important to know and listen to your body, and go to the doctor at the right time. If you go to the toilet and you pass stool and there is blood in it, and you ignore it and you keep passing blood for 6 months, and you never think, well, there must be something wrong, there's blood in my stool, and you don't go, you're asking for trouble. You should go and look into it. It is not normal to have blood in your stool. It is not normal to have blood in your urine. People choose to ignore it, and it's not normal to have a lump in your breast.
Yeah.
I feel a hard lump. I've been feeling it for 6 months. Well, why did it take you 6 months to come to the doctor?
Yeah.
You should have come sooner.
Allow me here to share some of my personal experiences. I think that a lot of people might understand that there might be something wrong, but they're hesitant in facing reality. And I'm going to mention here the journey of my mom that was a cancer patient. She had breast cancer. And there are definitely campaigns on how women could recognize breast cancer at initial phases, because she described to me that I was pressing my nipple and there was this fluid coming out. And initially she told me I ignored it because I went for an X-ray, for a mammography some months ago. Now, from my studies, what I've seen is that occasionally cancerous cells might not fully show on mammography or X-ray, but there are certain physiological signs or modifications, somatic modifications, that even if they're not being picked up by the diagnostic tools that we have today, they could potentially be recognized by the individual.
I have a question for you.
Tell me.
Is mammography 100%?
No.
Exactly. Is ultrasound 100%?
No.
Exactly. Is MRI 100%?
Closer.
Okay, so you get the idea. So there is around 4 to 6%, okay, that is going to be missed by either the mammogram or the ultrasound. And maybe your mom was one of those few patients. So that's what we always do. Always have a mammogram, always have an ultrasound, and a physical examination by a doctor who knows what he's doing.
So the combination
The
of
three things, okay? Doing one thing is not 100%. Okay.
That's something very good to know. And I love the fact that you've tied in your description how psychology relates so deeply with the physical symptoms that we are going to develop, and potentially, at the worst case scenario, develop cancer. Because in my practice, I see a lot of clients of mine having acid reflux, having irritable bowel syndrome, having thyroid issues, having autoimmune disorders because of their stress. And what I see, and basically from what you're describing to me, is that stress is in fact the premonition of something worse that might come later on in your life, and it should be addressed.
True.
I'm here today with Professor George Astras, a medical oncologist consultant who is able to help you find the best treatment in regards to cancer. No one should fight cancer alone. For those of you that would like to gain more information in regards to our guest today, please do not forget to check the description below. I want to ask you, how many types of cancers do we have?
Around 200.
Okay. So possibly we won't have the time to go deep into
No,
it.
I mean, you have to, I'll explain something that people don't realize, that 20 years ago when I was starting oncology, there is only one type of breast cancer. And we used to give the same treatment to everybody. now there's like 5 to 10 different types of breast cancer or combinations of breast cancer, okay, which we give individualized treatments to them, okay? And this is what you need to remember. Lung cancer, we used to be like 2 different types of lung cancer, small cell and non-small cell. Now there are subdivisions in each, okay? So we became, with our knowledge, more specific, and we target cancer more individually, okay? Which is a great thing because our patients now live longer, even with stage 4 cancer, me and my team, we gave, in 2016, we were the first ones to give immunotherapy to a lung cancer patient. The guy is still alive. Immunotherapy.
Can you please elaborate a little bit more about what immunotherapy is?
So immunotherapy is one of these newer and nice and expensive drugs that have been developed over the last few years, and it was put in the market in 2016, and I won't explain the mechanism, but I will explain what it does. So it boosts your own immune system. So it makes your immune system stronger, and your immune system goes and fights the cancer.
We're talking about T cells?
Not exactly T cells, but you're very close. Okay? T cell therapy is kind of type of immunotherapy, but not not really the same. So this is an infusion. We give it every 2 or 3 weeks, depending on which drug you're going to choose. Okay, there's virtually no side effects. Wow. Okay, patients carry on with their lives, get immunotherapy, and they live on. So this guy has been, he was told he was going to die in 2016. Okay, he came to me, I gave him immunotherapy, and he's still alive. And he actually now retired, okay? Which, it's a great thing, and this big revolution in oncology since 2016, because now we use combination of immunotherapy with chemotherapy with even better results, or a combination of immunotherapy with targeted therapy with even greater results. So, we have all these new combinations. I mean, it's so fascinating how the field has developed over the last few years that even some oncologists can catch up with the new trials. Sometimes I find it difficult, but I've learned, and every night I take my iPad before I go to bed and I look at some of the updates and I keep myself up to date, because the information changes so fast in cancer care. It's amazing, which is a great thing, especially if you're a cancer patient, okay? And, last week I was on TV, talking about the new development, because there was a conference in the States in early June about the new developments in cancer care. And there was these new developments with some drugs. And it's fantastic to give good news to people.
Yeah, Dr. George, I'm very happy to hear that you're constantly growing as a doctor, as a medical doctor.
You have to.
In oncology, because it's so essential to get up to date with what is the trending and best therapeutic regime for your clients, because this also, it takes away from your own personal time. True. But I see also your own personal drive to provide for the people that visit you the best possible solution for them. And I applaud you for that, because this is not a common trait among
There's a reason
doctors.
for that.
What could be the reason?
Everybody in my family dies from cancer. I lost one of my best friends at the age of 19 to cancer.
Now, I'm glad that
you were not expecting that one, were you?
I'm glad that you've opened this topic, because most of us, we choose our professions based on our own traumatic experiences that we had in our childhood. Mm-hmm. And I know that you're fantastic at your profession because of what you've just said, because you have a personal experience that became the motivation for you to come where you are today and be the top potentially oncologist that we have currently in Cyprus, because you were being led by certain adverse events of losing your best friend, maybe family members, due to cancer. And you're trying to solve this riddle of why and how can I heal cancer.
Yes.
I'm fascinated by
I
what you've just said.
always put myself in the place of the patient. And I say, what would I do if I was sitting there? I would have done this. So what I would do if it was my brother sitting there, my mother, you know? So I always put myself in
There's
the...
also a personal approach. Boop, boop. Hey guys, thank you for watching. If you're enjoying this video, do not forget to hit the subscribe button. It would mean a lot to us. We've heard your own personal story on what has led you to become an oncology specialist. Was there something else that you would like to share in regards to this?
Well, you know what they say, know thy enemy, you know? And, you know, I imagine growing up and seeing your friends and family members dying off to this disease, you know, and back then, you know, we're talking about 30 years ago, it was a big taboo talking about cancer. Nobody said, oh, you know, your aunt has cancer. They said, oh, you know, she has that evil thing. That's how they named it, or the unnamed thing. You know, nobody said, oh, she has cancer. No, nobody dared to say the word back then. So, you know, I saw these people dying and, you know, I said, well, they're dying from the same disease. And nobody seems to be naming this disease. And I was initially curious when at a young age about this. And then I lost one of my best friends. And then, you know, my grandfather, and then my other grandfather, and then my cousin, my aunt, and kept going. Every couple of years, I kept losing somebody, till now. You know, a couple of months ago, I lost my cousin to cancer, to an aggressive type of cancer, you know, first degree relative to me. So, you know, I started thinking that at an early age, you know, I have to learn about my enemy, this enemy that's taking all my loved ones away from me. And this is how it all started, in my need to find more information about my enemy, who's killing off my friends and relatives.
So that's a great journey and a great challenge that you have put upon yourself. But by you taking on that challenge with your knowledge, I think that we are in good hands.
Thank you.
Because definitely your love, your passion is also what makes you unique in treating your patients. Now, I do not really want to put this out there, but I feel like I have to ask this question. There seems to be cancer in the lineage of your family. Is there a specific genetic predisposition? Can we intervene? What do we do with it? Because we nowadays, there is this trend that exists that, oh, you're like that because you have this type of genes, so you cannot really change them. Is that true?
Well, yes, you cannot change genes, but you can change what you do about it. So I give you an example myself. So I did a genetic test called a pan-cancer genetic test. So I did that because, as you heard, I have lots of cancer in my family. So I did this test and I found out that slightly predisposed of developing bowel cancer. Guess what I did next? I went and had a colonoscopy, okay, and blood tests, okay, and I found some things, you know, high cholesterol and things like that, and I started doing things about it. Lost some weight, trying to lose a bit more, a bit of healthier diet, you know, a bit of exercise. So I'm trying to combine things to reduce my risk, my personal risk, Okay, have in mind that the genetic predisposition of all cancers is in the range of 5 to 8%. It's
Okay.
not that great.
Okay.
Okay, most cancer is developed by the other factors we talked about. Okay?
So environment,
Alcohol, smoking, obesity.
nurture above nature.
Yes.
Okay. So in your way, you kind of took these conscious decisions to do these genetic tests. You identified potentially a risk for your health.
For myself.
For
Yes.
yes, and
Acted
you
upon it.
acted upon it. You took certain conscious decisions to stop the expression of the gene
True. Or prevent it.
or prevent it, which is great. Would you advise people to have this test, this genetic
Or
test?
there's certain guidelines about the genetic testing. And if you have, depending on the condition, 2 or more relatives, first degree relatives that have cancer, then you should seek genetic counseling. And or an oncologist can advise you accordingly whether you should do or not. But all of us, okay, should at the age of 50 have a colonoscopy, a gastroscopy, okay? Men, we should have PSA testing from the age of 40 onwards. And women, they know with their pap test and mammograms, okay? We do this part of our screening for prevention. Also now there's been a development, there is this test that has been developed in the States called the Gallery test. And they take a blood from you and it's kind of a liquid biopsy, okay? And it detects, either cancerous DNA or RNA in your bloodstream years before you develop the cancer. Okay, up to 2 to 5 years before you develop the cancer.
Wow. Is this available currently in Cyprus?
No.
Are you going to bring it to us?
We'll try. But it's available in the States, and now it's on a trial basis in the UK. And it's a fantastic test. But we do have a liquid biopsy in Cyprus that we use for our patient, and as part of the monitoring. We do use that. But the technology is not quite the same. Okay? And if you combine that with all the other tests that I mentioned earlier, you get a sufficient amount of prevention. Also, be aware of what your body tells you.
Be mindful, absolutely. Now, could we combine all these lab tests with what we do on a daily basis, what we eat, the way that we carry out our day in an AI algorithm and tell us whether or not something bad is going to happen?
So again, I was on TV talking about AI like about a month ago. So AI is fantastic. I love AI. I mean, I was one of the first people that looked into it and slightly got involved in artificial intelligence. So what's happening now, there's lots of artificial intelligence algorithms, okay, that are running. First of all, there's an artificial intelligence algorithm that runs and tests your CT scan. So if you have a CT of your body, it can check and it can find out if you're going to develop cancer, okay, in a specific part of your body, because it can detect better
The pixels
or the signs than the human eye, than the radiologist. And it's going to take over in a few years in the diagnosis of cancer. And this means one thing, that we will be able to detect cancer earlier by doing scans. So we're kind of doing that now, but with the human eye. So for people who smoke a lot, we do what we call a low-dose CT scan, okay? And we check them maybe once every 6 months or once a year. We do a CT scan of their lungs to see if there's any early signs of lung cancer. With AI, which will be much easier to detect it, and hence you'll do the scans not every 6 months or every year, you'll do it every 2 or 3 years, because the AI will cover that amount of time, because it can predict that far ahead. which the
impressive.
human eye cannot.
That's impressive. Yeah, these are some very positive and great news about where we're heading in medicine.
It's fantastic what's going on in the world, and it's fantastic with AI. It's going to be involved in everything, and things you cannot imagine, And the fantastic thing is that it will be involved in cancer care. The more input, the more data you put into artificial intelligence, it becomes cleverer, more clever, more clever. A human does not become more clever. We are clever as we are. A radiologist gets more experience over the years. So you have a radiologist, he becomes experienced over the years, and then he retires. And then a new one comes in, gets the experience, he's at his peak performance at the age of 40, 45, then he retires at 65. You lose that information.
Will constantly keep learning and expanding.
AI will keep learning and learning, and all this data and information will be piling up over the years. So the more information you have, the AI has, the more precise it will become. The earlier the diagnosis, the earlier the treatment, the more the cure.
Because we don't have a lot of time together, what I've experienced with my family, with my sister, my dear sister, and my mother, that they have been through cancer, different forms of cancer, is that during chemotherapy or while they were under cancer treatment, they had a lot of pain, or they had all these side effects. And there is always this fear after, when you are a cancer survivor, that what if it comes back? Is there a way to kind of eliminate this fear that exists? Because fear is going to lead to stress, anxiety, potentially depression. You cannot be present. So there are all these cognitive issues that happen afterwards.
I don't blame them for having fear. Cancer is not a joke. Cancer is a disease that can kill you. The most beautiful thing in life is life itself. Everybody wants to live longer. And we're achieving that. We are living longer, and we are living longer with disease. We're not dying from disease, we're taking it with us. People are dying with cancer, not from cancer nowadays. You cannot blame any cancer patient from having the fear. At the same time, you should provide support and psychological support in a positive environment for them. Okay? And you talk about the cancer when they want to talk about it, not when you want to talk about it. Okay? You have to understand that most of the patients, they go through this cancer journey and then they throw it in the back of their minds and end of it, and they carry on with their lives. And, you'll be amazed how many people around you have had cancer and never told you, even close friends of yours. Maybe they had cancer and didn't tell you. And it makes you wonder, why didn't my friend, he's my close friend, why didn't he tell me about his cancer? Well, some things are better left
in the past.
And, some personal stuff maybe is not worth talking about it, especially if they're in the past. So, I believe that, everybody chooses their own path to freedom from this disease. And maybe that's what your, sister or mother did, and it is a personal issue.
It's a personal issue.
I don't try to get involved with it. I'm supportive. Whoever wants to talk, my door is open. But everybody should understand that panic doesn't serve anybody.
Anyone. Yeah. Dr. George, I also want to ask you, because I've heard this, I don't know if it's a rumor or if it's reality, and I want you to clarify this for me. The people that developed chemotherapy, were they Jews?
No.
Okay, no. And
who said that? That's a joke.
I don't know. This is that's why I'm telling you, if this is a rumor or if this is reality. And the people that developed it, in X country, I don't know where it was developed, you will tell me, they don't use it in their country.
That's BS.
Okay.
So you're talking about the Israelis, and I'm going to tell you something. Israelis are very good in treating cancer, and actually have many Israelis patients, and have many Israelis friends, doctors, and I know they do try to do their best, and they always are very keen in trying new technologies and new treatments, and this is a great thing because it brings them to the forefront of the game. And maybe that's where the reputation went a bit off track.
Okay.
The answer...
So they stopped using chemo?
They are.
They are still using
Yeah, they're using chemo. I mean, I have some of my patients that their initial chemotherapy was in Israel, and then they transferred back to Cyprus to me.
Okay, thank you for clarifying this for me.
You know? And I'm telling you, I have oncologists, friends who are Israelis, and they do give chemotherapy. They give the best treatments depending on the situation.
We've heard a lot about cannabis and cancer. Where does cannabis come in the picture with cancer patients, and in what form?
Very interesting to to ask me about that. So, I gave a lecture on this thing in the university many years ago when George Pamboridis was Minister of Health, and actually he and his group are the people who initiated the bringing the cannabis oil into Cyprus and into the medical plan. And I did the lecture there, and I pinpointed a few things in my lecture. And I could tell that in the audience there's a lot of cannabis, lovers. And what I tried to make them understand is that,
University students?
well, I don't know. Well, it was an open lecture. So, the auditorium was packed. Cannabis is a great tool in helping from the sidelines the cancer patients. So we use cannabis oil, CBD oil is licensed by the Cypriot government, and currently only oncologists can prescribe it. So this was the initial idea, because there was some evidence that it helps. It doesn't really fight cancer. It does very little to help the fight against cancer, but it does alleviate the symptoms, pain, anorexia, or chemotherapy, some chemotherapy side effects.
Irritable bowel syndrome?
It can help. And actually in my lecture, I did mention also a variety of 20 other diseases that cannabis can help in. And there's been studies about it. It's not like you cannot, hide the studies, or you cannot sway around it. It's true. It does help. But you have to choose which patients you will give it to. You cannot give it to everybody. Yeah, because it requires a specific way to give it. Okay, you need to increase the dosage, slowly, depending on what the effects are to your patient, and adjust the course accordingly. It's not like here can have cannabis and take it home and do whatever you want with it. It needs monitoring. It doesn't need monitoring because it's a controlled drug. It needs monitoring because you want it to have the desired effect. If you give it to somebody that doesn't have the desired effect, then you did them
okay. Okay. Basically, you're creating a dependency issue.
Well, it's not a dependency issue. You're trying to help people. If you don't control with your knowledge how they use it, or how often they use it, or how much they use, you're doing them a misservice.
For those individuals that are receiving CBD oil as part of their cancer therapy, what are the factors of, let's say, because we know that it has a form of a psychoactive effect?
Slight,
okay. What are those factors that could potentially not be the right environmental circumstances for them to take it? Like, can I drive and just drop a drop on my tongue, or do I need to be in the comfort of my home? Should I put some music on?
No, so what we usually say is we ask them to take it at night. Okay, because it calms you down, it helps you go to a deeper sleep, it helps you sleep better, and has all these good effects on it. I don't suggest, take it and drive. It doesn't have that much of an effect, but you should be careful. Don't have alcohol and drive. It's kind of the similar thing.
Okay.
But, you have to choose your patient. It has to be a compliant patient, a patient that will come and tell you, I'm taking 8 drops of cannabis oil and I feel good and we'll keep it there, So they have to tell you, and be able to recognize the effects it has on them and not hide it from you, and also be compliant in the dosage. So having a good communication with your patient and a trust between doctor and patient is very essential. But not only in this situation, in everything.
In every situation,
okay?
yes.
One of my policies is if a patient, I feel that they don't trust me or my team, I tell them there's no reason to continue together because it's not benefiting them.
One last question for you, and thank you for telling us more about how cannabis can aid cancer patients. Is there a way to heal cancer with our thoughts?
Not in the way you're thinking about it, but there's a different way, okay? Positive thinking. So there's been studies that show that patients who come into the office and they think positively and they say, okay, George, you're going to be my oncologist and we're going to fight this and we're going to do this and we're going to do that and we're going to do that, okay? Doing much better than the patients that come in the office and like this.
So psychology
is important. Positive thinking is massively important. If you see everything as doom and gloom, darkness will follow you. It's very important to recognize what's the darkness and it's the light in this situation. And as I always say to my patients, always follow the light. You cannot go wrong with that.
Always follow the light. That's a beautiful line to end today's discussion. Let's follow the light in our life. And you have also the right surname, which means stars for those that are listening. So we will follow your star. We'll follow your teachings. What you've shared with us today, it's absolutely essential for any human being that goes through cancer, through anything, in fact. I find this podcast particularly beneficial for anyone in regards to mental health, illness, cancer, the impact of positive thinking. So do follow us. Do not forget to subscribe on our channel for more exclusive guests. Thank you very much for coming.
You're welcome.
It's been an absolute pleasure.
Same here.
And we'll definitely speak again.
Sure.
Thank you so much for watching this episode. It's been an absolute pleasure filming it for you guys. If you like the work that we are putting out into the world, please make sure you like this video and you subscribe to our channel. It really helps the work that we do.
And if you would like to follow our journey on our IG accounts as well as learn more about our services, we provide everything for you in the description below. Thanks for watching.